So, you keep hearing about Wegovy and Ozempic, and maybe you have even heard they use the same ingredient. So why are they marketed so differently? Why do they have separate names, separate prices, and separate approvals? And most importantly, if you are trying to lose weight, which one should you actually be taking? Let us break down the real differences between Wegovy and Ozempic so you can make the right choice for your body and your wallet. Here is what most people do not realize. Both Wegovy and Ozempic contain the exact same active drug, semaglutide. It is a GLP-1 receptor agonist that helps regulate appetite, blood sugar, and digestion. But that is pretty much where the similarities end. Ozempic was originally approved for type 2 diabetes. It helps control blood sugar, and weight loss is more of a bonus. Wegovy, on the other hand, is FDA approved specifically for chronic weight management, for people with obesity or overweight, and at least one weight-related condition. That difference in FDA labeling matters more than you think. It affects how your insurance covers it. It changes who can prescribe it for what. And yes, it can change the out-of-pocket cost dramatically. Let us talk doses. Wegovy is prescribed at higher strengths than Ozempic. With Ozempic, the typical maintenance dose is 1 milligram weekly, though some diabetes patients may go up to 2. Wegovy ramps up more gradually, but ends at a full dose of 2.4 milligrams weekly, which is the amount shown to support significant weight loss. That means if weight loss is your main goal, Wegovy gives you more of the medication your body needs to get there. But that also means more side effects for some people. More nausea, more fatigue, more chance of needing to pause or slow the dose. Now, what about cost? This part gets messy. Because Wegovy is labeled for obesity, not diabetes, many insurance plans will not cover it. Ozempic might be covered if you have a diabetes diagnosis or elevated A1C levels. But using Ozempic strictly for weight loss, that is considered off-label, and many doctors will not write it that way. Still, some patients are prescribed Ozempic off-label anyway because it is easier to get covered. And when it works, it works. But remember, it is not always the full strength needed for weight loss alone. So, what are real people saying? On forums like Reddit and patient groups, you will find all kinds of comparisons. Some say Ozempic made them feel less nauseous than Wegovy. Others switched from Ozempic to Wegovy and suddenly saw the scale move faster. It really depends on your personal response and your access. If you are already on Ozempic and losing weight steadily, your doctor may decide there is no need to switch. But if your results plateau, or if your insurance allows it, Wegovy could unlock better progress. And here's a little pharmacy tip. Wegovy pens and Ozempic pens are not interchangeable. The devices, doses, and instructions are all different. So never try to substitute one for the other without your prescriber's okay. Now, how do you actually choose? If you are living with type 2 diabetes and weight loss is a nice bonus, Ozempic is probably your path. It is built for your needs. If your main focus is weight loss and your BMI is 30 or higher, or 27 with another condition like high blood pressure, then Wegovy is likely the better fit, especially if your insurance covers it. But in the real world, sometimes insurance decides for you. If you are feeling stuck, ask your doctor about step therapy, prior authorization, and medical exception letters. These tools can sometimes get Wegovy covered when it is first denied. Still unsure which way to go? Drop a comment below with your situation, what your provider recommended, what your insurance said, or what you are currently taking. There are thousands of others navigating the same maze. If this breakdown helped you understand the difference more clearly, go ahead and like the video. It helps others find answers too. Coming up next, oral Wegovy is on the way. No needles. Same drug, new rules. Subscribe so you do not miss that one. And if you have ever switched between Wegovy and Ozempic, how did it go for you? Let us talk in the comments.